Welcome to Living Well. This is an exciting topic today. We're going to talk about the doctor's visit. And this is a topic that many times people really don't talk about because they really do not often ask any questions before they go to the doctor. And so today, Emiyn, Mark, and myself will be talking about the doctor's visit. And I ask if you have any questions, please put them in the chat. We would absolutely love to hear what your thoughts are regarding our discussion today about the doctor's visit. So I do have a disclaimer. We always give the disclaimer. And our disclaimer is this is for educational purposes only. The information that we share will be from research, personal experiences, as well as from biblical references. In the event you have a specific question that you have for your doctor, we're going to ask that you refer that to your doctor because we do not assess, we do not diagnose, we do not treat. And so we do ask if you'd like to take notes, do so, but any changes in your lifestyle will be voluntary only, and it will not be anything that we absolutely would recommend for you. But we're so happy that you're here today, and we're going to actually begin our conversation about the doctor's visit. So hi, Miss Mark, how are you?
Well, I'm doing okay. I have been doing better, but for the past couple of weeks, I seem to be having some issues.
Okay, so what brings you to the doctor today?
Well, as I said, for the past few weeks, I am not feeling well. It seems that since I turned 50, things just seem to go downhill. I was having, I'm now having frequent headaches, which are not normal for me. Also, I noticed that I am going to the bathroom more frequently. I'm having frequent urination. And even at nighttime, I have to get up to go to the bathroom to urinate. Therefore, this interrupts my sleep, and it takes me longer to get back to bed, get back to sleep. Because I do not get sufficient sleep during the night, I feel so tired during the day, listless. So to tell you the truth, I spend a lot of time on my couch watching soap operas and drinking sodas. I drink sodas because I do not like the taste of water. It just does not have a good taste in my mouth. So that's what has been happening to me for the past several weeks now.
So, when you came in, the medical assistant took your blood pressure and it was 190/90. So that's pretty high. And your blood glucose level was 250. And I noticed that from your last visit, you've actually increased your weight and now you're about 185. So what do you think is contributing to all of those changes in your numbers?
Oh my goodness. Well, I seem like I've gained over a little over 10 pounds since I came here the last time.
Good.
Well, you know what? Oh, as I told you, I just turned 50, so I was planning a big birthday party, and I had lots of friends and family, and I came over, and I just splurged. So maybe that's part of my weight gain and the high blood sugar, because, cake and all that sweet stuff that I ate during that period. So maybe that's what caused my blood sugar and my blood pressure to go up so high.
So you think maybe just that one incident might have caused that to cause your weight to go up 10 pounds?
Well, that's true. To tell you the truth, I really am not doing what I'm supposed to do. I know I should be exercising more, but I don't feel like exercising. So since you saw me the last time, I am more sedentary. I am not exercising. I am eating more. And all of those things now have come to haunt me.
So what I'm going to do, because we want to get this under control, hypertension can lead to a stroke. And hypertension is a silent killer. So many times you don't realize the effect that it's having on your vessels. We know with diabetes, it does affect your circulation. So with that high sugar in your blood going through those vessels over time, You're going to have some difficulty, possibly numbness in your lower extremities, and it's also going to lead to kidney diseases and other problems. And then with your weight, unless we get it under control, it's going to continue to increase. So I'm going to give you, there's 3 things we're going to do today. Number 1, we're going to give you a prescription for your blood pressure, a prescription for your diabetes, and then I'm going to have you meet with the weight management program that we have right here in the office. And then I want to see you back. I want to see you back in 6 weeks. Will that work? So
Okay, I sure will try. Thank you.
So take the prescriptions and then the weight management program, and I'll see you back in 6 weeks.
Okay, Dr. Sankey, thank you so much.
You're welcome.
Oh my, I really need to take care of myself. Now I am on all these medications. I do not like taking medications. But the doctor said I have to take these medications. And what is this? Oh, metformin. I wonder what is that for? And lisinopril. You know what? I really did not get any clear explanation why I should be taking, or what is lisinopril and metformin for. But anyhow, I just go ahead and take them. You know what? I have been taking these medications for almost 4 weeks now, a whole month. And nothing is changing. My blood pressure is still high. My blood sugar is still high. You know what? I think I'm going to increase this medication. I'm going to start taking maybe double dose. That way, maybe my blood sugar will get down and my blood sugar. So when I go back to the doctor the next week or so, wow, my doctor will be proud of me. Hi, Doc.
Welcome back, Miss Mark. So let's hear what's been happening for the last 6 weeks. How are you feeling?
Well, you know what? For the first 4 weeks or so, the first month or so, I've been taking this blood pressure and diabetic medication, and I've been feeling okay. But I noticed my blood pressure's still high and my blood sugar really wasn't going down. So I decided to double up on the medication. And for the past week or so, I am not feeling well. I'm feeling a bit dizzy. I'm a bit shaky. Even at nighttime, I'm getting some night sweats. I do not know what is going on now. I am not feeling as I supposed to.
So I think that medication may have had an effect. You're doubling it up. When the medical assistant took your blood pressure today, it was 90/60. So it has dropped so drastically, and I think it's attributed to you taking twice the dose that was prescribed to you. Now your blood sugar came down a little bit. It's only 200 now. It's not 250. But did you get a chance to do the weight management program?
Oh, not yet. You know, I'm so busy. I have so many.
So you haven't had a chance to do the weight management program?
No, but I plan to.
Okay, so I noticed you have someone with you today that you brought along with you.
Yes, I brought my friend Josephine along with me, but you know, she knows more about medical terminologies and she understands these things better than I do. So I brought her along with me so she can help me remember some of these things, because when I got home after that last visit, I couldn't remember some of the things we spoke about. So I decided this time I was going to bring my friend with me so she can take notes, so that, you know, when we leave, we can discuss and she can help me remember what I need to do.
Wonderful. So that's good. And I look like you have a list of questions for me this time. It's different from last time.
Yes, so this time I came with some questions because I am puzzled. You know, first of all, I'm trying to figure out what these medications are for. Which one is for blood pressure? Which one is...
So you're trying to decide which medications for blood pressure and which one is for your diabetes, it sounds like. Okay. So let's try to help with that. So I gave you the metformin, which would help you with regulating your blood sugar. It is so very important that you,
For my diabetes, I'm trying to find the effects of this medication.
so it's important that you take the metformin with food. It is for your blood sugar. And we want you to continue to take that. Make sure you take it as prescribed. Do not take any more or any less, because it could drastically drop your blood sugar. Or if you're not taking it as frequently as prescribed, your blood sugar may continue to elevate. And remember, with diabetes, it can affect your circulation over a period of time, as well as it could cause neuropathy in your lower extremities, and we don't want that to happen. For your diabetes, for your hypertension, again, very important that you take it as prescribed. Even if your blood pressure begins to normalize, we want to make sure that you still take it. What questions do you have for me?
So do I have to take these things all my life?
So for right now, you need to take them until we can get your blood pressure and your blood sugar normalized. As we mentioned, if you do the nutritional classes and go to the weight management classes, it may be a way, we're not guaranteeing anything, we can normalize your blood sugar and your blood pressure so that you could possibly make some adjustments. So the three things that we need to do this time, I will set you up with a diabetic educator. Really important, Ms. Mark, that you go to those classes and that you learn what foods that you can eat, learn how to prepare them, learn how to the frequency, how much. Also, I'm going to set you up with a nutritionist. That's very important. That's going to be part of that diabetic. And then the weight management class. Those talk specifically about exercise, because I remember you saying that you're sitting on the couch, watching the soap operas, drinking your sodas, eating your cakes and cookies. And those are the things that are contributing to the conditions that you have today.
Yeah, what I did, you talked to me about those sodas, so I stopped drinking those sodas. Now I am going to the store and I'm buying fruit juice and I'm drinking more orange juice and apple juice. So I stopped drinking the sodas, but I'm drinking more juice now.
So Miss Mark, when you go to those classes, they're going to teach you to read the label, because a lot of those juices have a lot of sugar in them, almost as much sugar as the sodas. So we want to make sure that you understand how to read the label, look for sodium content, look for sugars that may be in those food items, making sure that those food items don't have any more than 5 ingredients, because if they do, most likely it is not going to be the healthiest for you. And so we want you to recover. We want you to live well. And so let me share with you, what questions do you have for me?
Should I take these pills with food or away from food?
So I would advise you take them with food, take them earlier in the day so that you can see exactly how your body's going to respond to those medications. Try not to take them at bedtime, because you don't know what your body will do. So it's very important that you take them early in the day. So let me share with you just some really important information. Did you have a question for me?
Okay, Doc.
So I'll see you back in, let's say 4 weeks.
Okay, sure. Thank you.
You're welcome. So let's talk about this scenario that you just saw. This is important. Number one, you want to know how to choose a doctor. All doctors have different specialties. So you want to choose a doctor specifically for your problem. You want to know how to prepare for a doctor's visit. What do I need to take with me? Who do I need to take with me? What can I ask? What should I not say? How to be involved in your decisions, and also asking the right questions. And lastly, we're going to talk about how to evaluate your doctor's visit. So choose a doctor, what you need to know. Know the type of doctor you need. Some doctors are specialists, some are primary care physicians. They all have their different specialties that you want to be informed about. Learn your doctor's credentials. Are they board certified? Do they need to be board certified? You can ask friends and family for references, but remember, everybody's experience is going to be different. So again, and you want to know what are the doctor's beliefs, because you want to make sure that they align with your beliefs, whether they're religious beliefs or any other type of beliefs. their location. Are they close to your home, far away from your home? And then whether or not they take your insurance. The next thing you want to do is prepare for the doctor's visit. Make a list of your concerns and take the list with you. Many times we'll jot something on a piece of paper, on the back of a receipt, different places, and we forget to take the information with you. When you take it with you, it actually saves you time and the doctor's time. Make a list and take a list of all of your medications. If you don't feel like writing them down, take the bottles with you in a bag. But your doctor needs to know what you're taking so that if they begin to prescribe other medications, then they will know what you're taking to see, make sure that there's no contraindications for the medicines, and also take the name of your pharmacy. When a doctor calls on a prescription, if they can call it to the pharmacy where you're accustomed to picking up that medication, they will have your allergies, they'll have all of your information, your home address, and everything. And consider taking a family member with you to the doctor, because oftentimes there's so much information. Even if you can see and hear well, sometimes it can be overwhelming to have so much information at one visit. And do you need an interpreter? Now, not every family member is created equal. So some people have medical backgrounds, some do not. But you want to take someone with you. And if you speak a different language, it's very important to take someone who can actually interpret if needed. And then plan to give an update on what has happened since the last visit. You heard Miss Mark. From the first visit to the second visit, she actually had different symptoms. And it's simply because she was taking the medication not as prescribed. So you want to be able to tell the doctor, are your symptoms, what are your symptoms? What are the frequency? What makes them better? And are they worse? And these are very important ways that you can prepare for your doctor's visit. And then be prepared to ask questions about lab tests. What is it for? Should I eat or not eat? Should I drink water? Are there herbs that I should avoid? What about vigorous exercise and stress? And what will the results from that test indicate? Remember, why am I going for the test? And what will the results show? Those are the key messages for any lab tests. And then what questions should you ask your doctor? These are things that you can ask. What is my diagnosis? What may have caused this condition? Will it be permanent? Or how is this condition treated or managed? And what will be the long-term effects on my life? These are important questions to ask your doctor. Write them down and be prepared to ask them, because you want to take charge of your health by asking these questions. So Emiyn, I'm going to ask you in just a moment, what are some of the questions that we should not ask our doctor? But you want to ask one more question. How can I learn more about my condition? Not only taking notes while you're in the doctor's office, but also get written materials from your doctor's office. You want to talk to the doctor and the healthcare members that may be in the office, and then make sure that you evaluate any health information that you get off of the internet, because that information, is it reliable? Is it credible? Who wrote it? So again, the internet, take caution before accepting that information unless you absolutely know how that information was gathered. Emiyn, please tell us about what we should not say to our doctors.
Yes. So some of the things that we should not say to our doctors, anything that is not truthful. So when the doctor asks you about your symptoms, do not downplay it or do not exaggerate. If the doctor asks you if you're normally having headaches, do not say, well, no, I'm not, when you are, because your doctor might want to order further tests in order to find out why you're having that headache. And if you downplay that, then that would be a missed opportunity. Or do not exaggerate your symptoms. The doctor asks you about pain, and you start saying, oh, yes, I have pain all over. It's constant, and it's like a level 10 pain. So now your doctor is thinking that you have severe pain, and they're going to prescribe medication for pain that maybe you really do not need. Maybe they might prescribe a narcotic when you can simply take maybe some Tylenol for the pain, because the pain is not so severe. And then you start taking these narcotics, and then there's all these symptoms that can develop from taking too much narcotics when you don't really need it. anything condescending and loud and obnoxious. Doctors are people, and sometimes they might make mistakes. And we do not want to get belligerent and overreacting and just be loud and say things to them that are not nice. Sometimes our doctors, maybe even much younger than us, we want to be respectful and call them do not call them by their first name, but call them by the profession. Because you want to build that relationship with your doctor. Relationships are very important with your doctor, because if you don't have a good relationship with your doctor, then it would be a problem. You wouldn't want to trust your doctor might not even want to treat you, and so forth. Do not use obscene language. Again, be respectful. When we are talking to our doctors, make sure that our language is clean, because we do not want to disrespect them. Anything related to health went off the clock. So anything related to health went off the clock, meaning if you see your doctor maybe in the grocery store or out of the clinical environment, do not go up to them and start asking them questions and trying to have them diagnose what's going on with you. That is very, inappropriate. The doctors cannot do that. You're putting the doctors in a spot where they are not able to help you. They don't want to give you wrong information. And there's something called HIPAA. So we have to be careful where we are when we are talking to our doctors. All of this needs to be done in the doctor's office. So when you see your doctors off the clock, don't go ask them questions about your health. They also want a break, because you don't want someone to come up to you or your supervisor to call you at home and ask you questions about what's going on in your job. Same thing with your doctors. They don't want to be questioned when they're off the clock. Do not complain about other doctors, because here you are in front of a doctor complaining about another doctor. That doctor might be thinking, if they're complaining, or if she or he's complaining about that doctor, what are they saying about me? So doctors are very careful in this regard, because they don't want to be sued, because the doctor might start thinking, if this person is like that, they have that temperament, they might start finding fault with me too, want to sue and all of this. So again, you want to build a relationship with your doctor that is healthy. So if you have a problem with a doctor, talk to that doctor. Maybe it's a little misunderstanding. Once you explain to the doctor and you all talk about it, maybe you can clear all of that up. So do not go about discrediting your doctors. Anything that's huge or do not overreact. For example, if the doctor comes in with a diagnosis and maybe it's not a good diagnosis, try and stay calm. Do not overreact about what's happening. Do not overreact. Like if you have medication, the doctor orders some medication for you to take, and you might say, oh my goodness, this is a whole bunch of medication. I don't want to do this. Stay calm. Your doctors, like when you come to visit, that visit is pleasant. They will always want to help you. They will always be there for you. So just take these hints into consideration when you see your doctor.
Thank you, Emiyn. That is so true. There's a lot of things that we should and should not say, should and should not do, simply because doctors are people too. If we can just stress that more and more, that doctors are people too. I think many times we get so emotional about whatever they tell us that we honestly forget that they are people too. So let's talk a little bit more about when you go to the doctor, what else? Not only are you going to ask about your diagnosis, not only are you going to know not what to say, but the next thing we want to talk about is stay involved, get involved in your decision making. Make sure that you don't just allow the doctors or the medical assistant, whomever just tell you what to do, you want to talk about the choices. So there's 3 things that you want to do to stay involved in your decision. Number 1, you want to discuss the choices. What are my options? What are the pros and cons of the treatment that they're offering? What's the cost? What's my belief? And will it interfere with my work schedule? Is there a different treatment that I can try? Yes, you've given me this high blood pressure medicine, but can we try something different? And then how soon should this medication, how soon should I expect it to work? Those are important decisions or choices that you should be involved in. And then next, talk about the risk and the benefits of the treatment. What are the side effects? Remember, we talked about side effects as it relates to when Miss Mark went to the doctor. Of course, she took more than was prescribed. So she was having the dizziness, the lightheadedness. She was having more, I'm going to say, an adverse reaction because she was taking more than was prescribed. And then will the treatment work for you? Remember that all medication, all treatment they've been researched, they're pretty much standard, but they're going to work differently for everyone. So you want to be mindful of that. And then also discuss prevention. Many times we think a pill will do, but it may not, it may be something that we can do rather than taking a pill that can help prevent advancing our condition. It can prevent us passing these things down to the next generation and the next generation. And the 2 things that come to mind for prevention are diet and activity or exercise. Sometimes just a modification of your diet and more exercise can actually help with managing whether it's diabetes or hypertension or weight management. Those are some simple things that we can do to take charge of our health and be involved in the decisions. And remember, the doctor worked for you, essentially. So you want to evaluate that doctor's visit. Did the doctor give me a chance to ask questions? Think about it. Was the doctor really listening to me, or did they have their back turned to me and was on their computer? Or could I understand what the doctor was saying? Did they speak in a language that I could understand? That is really important, that you are able, that they're speaking in a language that you can understand it and ask questions. And was I comfortable? Did I feel comfortable to ask a doctor to say again, what was my diagnosis? What was my treatment? When did they want to see me again? All of those are things that you as a patient, a consumer of healthcare, should be able to do with each and every doctor's visit. Because when you go in, you're going in because there's a problem or concern that you have. When you leave, you want to make sure that your questions about that concern have been answered. So the question that we have for our audience today, Emiyn, what's that question, Emiyn?
Oh, to choose your doctor.
So are you ready to live well? That's the question.
Oh, are you ready to live well? Yes.
Okay, so I want you to wrap it up for us, Emiyn. Go ahead and just go do a summary for us, summarize it.
Okay, so as we discussed, choose a doctor who you can trust and meet your needs, and listen and will listen and explain when you ask them questions. Very important. Be prepared to tell your doctor about how you feel and be truthful about it, because your doctor can only treat you by what you tell them, the symptoms that you are expressing. Write a list of your concerns and medications, because when you get into the doctor's office, many times you tend to forget some of the things that you want to ask the doctor, and then when you leave, that's when you remember, and it's too late. So write things down. Ask the doctor about causes of health problems and effects, and also recommendation and treatments, because as Dr. Sankey said, some things can be treated by exercise, by changing your diet, by getting more rest, by drinking more water. Some of those symptoms can subside. So ask the doctor about causes of your health problems and the effects it will have on your body, because diabetes and hypertension and those problems have a lasting effect if you do not take it under control at the early time. Get involved in your decisions. Now, this is your body. you need to make sure that you take control of your body. Your doctors can tell you all what you need to do, but if you do not take that opportunity to follow your doctor's plan of care, it will be of no avail. Ask about options, side effects, and prevention. I always say prevention is better than a pound of cure. So if you can prevent something from happening, know how to prevent it so you do not go down that long road of health problems. Evaluate the doctor's visit. Were your questions answered? And do you understand what you need to do to take charge of your health? Very important. Do you understand what you need to do to take charge of your health? Because you're in the driver's seat and you are the one controlling that vehicle. So make sure you get all of your questions answered. And doctors are very pleasant. They like when patients ask them questions because they see that you do care about your health and you want to get involved in it. So they would take the time out to sit and talk with you.
Well, great. So thank you so much for that summarizing that, Emiyn. I really appreciate that. So we're going to open the floor for questions from our audience. Certainly, there must be some questions out there about the information that we went over today, and we would love to have them. Feel free to open your mics, open your cameras if they're closed, and we would love to hear the questions that you may have.
Or write it in the chat if you do not want your voice heard. I hope I'm not putting my sister on the or making her uncomfortable. Juliet?
I'm here.
Yes.
Okay.
Yes, my dear. You know, you
Y'all
shared with me.
keep flowing me off. I keep hearing Miss Mark, and I'm thinking, but it was
Yes.
not for me.
So this question is for you now. So my sister shared with me an experience. She went to her doctor this week and she shared with me an experience she had with her doctor. So Juliet, do you mind sharing that with us today regarding what you told your doctor your plans are?
I told my doctor, first of all, my appointment was at 8 and she is trying to help me with my diabetes. And I saw her walk in there because it was a person week with a 12-pack, not a 24-pack of Coke. I did not tell you that. So she's telling us how to eat, telling me how to eat, but there she was. Anyhow, I told her that I was tired of taking meds and I planned to stop. And she looked at me, but she did not, I was not finished with what I was saying. And I told her that I want to go on a plant-based thing, meal plan. She was so excited. She was actually clapping. And she was saying, well, with the plant-based, she would tell me ahead of time that my blood pressure will be under control and my diabetes will be under control. And she told me that is the best thing to do. She even told me that I could do it. But so I told her, probably I need to come back and see her more. But she said, no, all I have to do once I start this is to check my blood sugar each day. And if it is under 70, to call her. So she already put herself out there willing to help me. And she was very excited in what my decision is. Then I was thinking probably the doctors cannot impose on patients what they need to do apart from taking the meds. Because I was wondering why she never told me about a plant-based diet before. But no other doctor she was not the one who diagnosed me. I had another doctor prior to that. That doctor did not talk about plant-based. My current one did not, but she was very excited about what my decision was. Then we did blood tests, and my AN1 was a bit high. And most time when that happened, they will change my meds. The nurse told me that they are not going to do anything because as soon as I start this diet plan, it's going to regulate itself. So I see from what the doctor is saying to me, the nurse, the plant-based diet is the miracle pill.
Wow.
I love the way you said that, Juliet. The plant-based diet is the, because we're always looking for a miracle pill, but
Right.
great. I love the way you said that.
Yeah.
Very much.
Yeah. Because, you know, all this time that doctor knew that just by changing your diet, you can improve your lifestyle. But she never mentioned it.
Mhm.
Is it because they are taught in medical school just how to use medication? This medication is for this diagnosis, and that's all they focus on. So that's why, as Dr. Sankey said, we need to take control of our health. We in the driver's seat, we need to be able to drive that vehicle.
She have told me before, stay away from Coke, stay away from sweet tea, but you know, they would not say stay away from meat and fast food. Well, that's my experience.
Okay. So we have a question in the chat box, Emiyn. It's,
Yeah.
hello, good day. What would be the cause of a 15-year-old feet to ankle area being swollen? Feet to ankle area being swollen. He hasn't hit it, so that's not the cause. It's been happening for some years. And before we checked it out, they said it's low protein, but we're tired. But we tried.
So we try.
And now we're checking again because it's swells now and again like before. That's another disclaimer. I'm not a medical doctor.
Yeah.
So
So I would encourage you, if you're not getting good results with that one doctor, maybe you need to change doctors. But you really need to go see a doctor so that they can look at the whole picture to see why the ankle is constantly swelling. There can be so many different reasons for the swelling of the ankle.
yes. Any other questions? Feel free to open your mic. All right. Hopefully we answered your questions. Hopefully you're better prepared to go to your doctor, to be engaged and involved in it, to know what questions to ask. That was our goal today, was to really make sure that we go over this information, because many times we'll talk to our family and our friends about how we're feeling. We're not feeling well. We're not feeling our best. And we say, when I go to the doctor, I'm going to tell them. And then they come home and say, what did the doctor say? And that's the very question we did not answer or ask the doctor. But in the Bible, there's so many scriptures that we can go to as it relates how we care for our own body temple, or God's body temple where the Spirit dwells. And in 1 Corinthians 3:16, it says, know ye not that ye are the temple of God, and that the Spirit of God dwelleth in you. So what that means is how we care for our body is very important, because the Spirit of God is dwelling inside of us. Not only do we have a heartbeat and we have a stomach and a liver, but we have the Spirit of God dwelling in us. What that means is we want to take the very best care. We want to be good stewards of our body. And then in John 16:13, it says, when the Spirit of truth comes, he will guide you into all truths. And I'm going to use Juliet as an example. She has made a decision, and many of us on this platform have made a decision, when we learn truth about how to care for our body, that we take those steps to start moving closer to that truth. And that's very important, that as we learn truth, that we live not only hearers, but also doers of the word. And then in Proverbs 3:6, in all thy ways acknowledge him, and he shall direct thy path. What this has to do with our conversation today. Sometimes you don't know about the doctor. Sometimes it's a referral from another doctor, but you have to seek God's guidance and his counsel as it relates to which doctor you should go to and whether that is the right one for you. And so just always seek God to direct your path, whatever decision you make, whether it's for the doctor, for your treatment, or how you want to care for your own body. And then lastly, sometimes the doctor will give us so many different prescriptions or things to do. And, we say, I can't do all of this. And you're right, we can't do it by ourselves. But Philippians 4:13 says, I can, I will do all things through Christ who strengthens me. And so this is important that we use scripture to guide our decision making, to guide how we care for our body. Everything is in the word of God of what we need before we go to the doctor's office, while we're at the doctor's office, and after we come from the doctor's office. So we've already opened it up for questions. I don't see anything else in the chat box. Do you, Miss Emiyn?
No, it's nothing else is there.
So thank you all so much for joining us today. We have a very exciting topic. Hey, Emily, tell us what's going to happen next week.
So next week, we're going to have Dr. Wendy Perot presenting our symphony, our biological symphony, very important subject. I would like for you to invite others to come join so that they can hear how we can take care of our bodies and how our bodies work in harmony. Just like an orchestra, we have different instruments and they have, different purposes and they make different songs. The same thing with our bodies. We have different hormones and organs and all of this that work together to make this body a whole. So come next week at 4:30 again, invite a friend so that we can have a great audience to hear this wonderful topic.
Thank you so much, Emiyn. So we're going to pause and we're going to pray. And we know that prayer changes things, prayer changes us. And so it's really important for us to pray because God knows our heart. And the fact that you're on this platform today is not an accident, not at all. It's that God has sent you here. And so we're going to stop the recording and ask for any